More than 3,500 people died from drug poisoning in England and Wales in 2015, the highest since records began in 1993. There were 3,674 drug poisoning deaths involving both legal and illegal drugs, and of these, 2,479, or 67%, were drug misuse deaths involving illegal drugs. Figures revealed by the Office for National Statistics, ONS, revealed on average 43.8 deaths per every million people. Registrations of drug misuse deaths in England increased by 8.5% in 2015, following an increase of 17% in 2014 and 21% in 2013. Males were almost 3 times more likely to die from drug misuse than females, with 65.5 per million males and 22.4 deaths per million females respectively. Vanessa Fearn, researcher, Office for National Statistics, said, deaths involving heroin and morphine have more than doubled since 2012, partly driven by a rise in heroin purity and availability over the last 3 years. Age is also a factor in the record levels of drug deaths, as heroin users are getting older and they often have other conditions, such as lung disease and hepatitis, that make them particularly vulnerable. The ONS said, drug use and drug dependence are known causes of premature mortality, with drug poisoning accounting for 1 in 6 deaths among people in their 20s and 30s in 2015. Deaths involving heroin and/or morphine doubled in the last 3 years to 1,201 in 2015, and are now the highest on record. The mortality rate for deaths heroin and morphine declined between 2008 and 2012, with a particularly sharp fall between 2009 and 2011. The figures show. The recent reversal means the mortality rate in 2015 was the highest since records began in 1993 and now exceeds the previous peak in 2008, which occurred before the heroin drought. The drought in 2010 to 2011 in the UK reduced availability of heroin and affected the purity of user level or street heroin. Heroin has also got cheaper. The ONS said it has fallen considerably from a peak of around £74 per gram in 2011 to around £45 in 2014. The ONS said heroin and morphine are the 2 substances were the most commonly mentioned substances in drug-related deaths. Deaths involving cocaine reached an all-time high in 2015 when there were 320 deaths, up from 247 in 2014. People aged 30 to 39 had the highest mortality rate from drug misuse, 98.4 deaths per every million people, followed by people aged 40 to 49, 95.1 deaths per million people. In 2015, the mortality rate from drug misuse was significantly lower in England than in Wales, 42.9 compared with 58.3 deaths per million population. In England, the North East had the highest mortality rate from drug misuse in 2015 for the 3rd year running, with 68.2 deaths per every million people. The East Midlands had the lowest, 29.8 deaths per every million people. Rosanna O'Connor, Director of Drugs, Alcohol and Tobacco at Public Health England, said, drug use is the 4th most common cause of death for those aged 15 to 49 in England, and we know that the majority of those dying from opiates have either never, or not recently, been in treatment. Reassuringly, overall drug use has declined and treatment services have helped many people to recover, but there is a need for an enhanced effort to ensure the most vulnerable can access treatment. There is considerable variation across the country, with some regions showing large increases in recent years. Public Health England will continue to support local authorities in delivering tailored, effective services where people stand the best chance of recovery. Alcohol Map of England. Drinkers in Salford are most likely to end up in hospital. Watch more videos at video.5la.net.